Session 3 and 4 taught by Dr. Reams in Black in 1977. This is tape 4 side B.
Let me mention something to you. I told you that the adrenals have to be balanced with the pituitary and the thyroid if you're going to get some of the things that you want out of this person. Okay? Sounds great. Sounds great. You ain't just a kidding. You know, I wish they would make longer weeks, okay, so that we could spend less hours here each day. But anyway, it's a long trip. Get as much as you can. But anyway, how can you tell if the pituitary is involved? Simple test to determine if the pituitary also needs support. Okay? There's a real simple way of determining if the pituitary needs support. Okay? They will make statements to you like, I can't work under pressure. My nerves are shot. I'm ready for a nervous breakdown. You know, they will begin to show other mental processes, showing changes. In other words, you know that they will begin to go through some pretty wide emotional swings. Okay? This is one of the simplest clues to suspicion that the adrenals, that the pituitary also needs support along with the adrenals when you're building up a program. Okay, what does the adrenals, or what does the pituitary want? Well, one of the things that it would like to have is manganese. The pituitary needs manganese. And manganese phytate or phytic usually works pretty good. What'd you say, Doc? Okay. He said, Doc says manganese phosphate is even better than the phytate, which would be fine. Also, continue your chlorophyll, continue your algavim, and add B12 into the diet. And that's some of the things that you would want to build up. Now go by your numbers relative to your calciums, okay? Go by your numbers relative to your calciums. But anyway, those are some of the things that you would want to add in. Then, if in fact you would suspicion that the pituitary is involved. Now, what if the thyroid is involved? Well, how can you determine? Well, the first thing you have to do is determine whether or not they're hyperthyroid or hypothyroid. Okay? But then there's a simple solution. Okay? If they are hyperthyroid, they'll sweat very frequently and all the time pretty well. If they're hyperthyroid, they always tend to be it always tends to be easy for them to perspire. There will be a rapid pulse rate in every case of hyperthyroidism. That is what is referred to as the pathognomonic sign. In other words, that sign that is always present. Okay? There will be elevated pulse rate 100% of the time. There will be weight loss, vertigo. And here's a simple trick to catch the hyperthyroid people. Have them stick their tongue out at you as far as it'll go and watch it. And if they're hyperthyroid, the end of their tongue will tremor. And while you're out there, check them for pinworms. When the front 3/4 inch of the tongue, if it has lots of little red tiny dots on it, it's significant. It's a significant check for pinworms. Now, don't mistake the papillae of the tongue for little red dots. You will be able to see these. There'll be little red pinhead dots on the tip edge of that tongue, right out in here, and there'll just be all kinds of them right out on the tip of that tongue. And that's one of the most alert tests that you can utilize, especially, for instance, on a young child. Because sometimes a young child, you may not catch him itching his rectum. He may not be able to because he's got a big, thick pamper on, and so he just lays there and fusses hour after hour after hour, and the parents keep shoving a bottle in his mouth, hoping he'll quiet down, and all that's really going on is that he's just out of his mind due to rectal itching. Okay? So you can check his little tongue, and it's a pretty easy check, and it'll show up on adults too. But on hyperthyroidism, a very simple thing is, Doc always tells you to look at their tongue anyway, and that if you see health coming back in, you'll see a healthy redness, pinkness developing along the edges of the tongue, and gradually it will develop up over the top of the tongue until finally the coating and everything else is gone and the tongue is pink and red and lovely again. And the ancient Chinese physicians could look at the tongue and tell you just about anything you wanted to know, including when your birth sign was. But anyway, the point of this is that in hyperthyroidism there will be tremors of the protruding tongue. So while it's out there, check for the relative pinkness along the side of the tongue, how badly it's coated, and pinworms by looking at the end of it. Okay, might as well team things up. Now, low calcium is a factor in hyperthyroid people. Low calcium. Now, you know what that's going to do to the pHs, okay? You know that pH is going to be down or up. So, low calcium is going to be a factor, so you have to go by the numbers there. And there's going to be very, very high phosphorus in a hyperthyroid person. So, you want to watch, because in general, if that phosphorus is high enough, this particular person not only will have a low sugar, but he will tend more toward an acid system. You can double check that by checking his skin, going by the numbers, etc. And there will be an increased basal metabolic rate. Later on this week, we'll tell you how to figure the basal metabolic rate without having to have a BMR machine. And he has a spooky personality. Has a spooky personality, you know. He really tends to be kind of a flighty type of an individual, you know. Used to be that the hyperthyroid person was considered to be the tall, thin bookworm. Okay, well that's foolish, because I'm a short, fat bookworm, and I'm not hyperthyroid. So bookworms do not denote hyperthyroidism. Now they may, oh yeah, I'm spooky, okay? I heard that. Take his name, Doc. He doesn't get in class 4. But anyway, they may or may not have bulging eyes. Sometimes hyperthyroid people will have eyes that are very, very prominent, but they may not have them. Yes, lovely lady. Hi, sweetheart. Haven't seen you for a long time. You look nice. Who what? Who have high phosphorus loads already, hyperthyroidisms. You kind of set on your men call for a while. Instead, go over on the other side to your algovims and set over there for a while. Okay? Because same way, you know, sometimes too, when you have hyperthyroid people, you have a greater tendency toward arthritic conditions too, don't you? And remember what Doc says about watching men call sometimes that will irritate an arthritic condition? Okay, so it's basically the same thing. Set on it till you get the numbers in line, then you can start it up. Okay, now some tips on hypothyroidism. And in hypothyroidism, there is weight gain, particularly in the upper body. And you will find these people having brittle or ridged or thick finger and toenails. Brittle or ridged or thick finger and toenails. They a lot of times have numbness in the hands and feet, or their hands and feet go to sleep easy. Now this is a unique factor. They can't stand the cold. I'll guarantee you what I am. My adrenals are in pretty good shape, but I'm hypothyroid because I absolutely cannot stand the cold. Okay? Now you will also find that they have coarse hair. Coarse hair, and very frequently it's brittle. Very frequently it falls out pretty easy too. But I think I'm gaining on it. John Truesdale's Bitty Buddy sold me about $40 worth of jojoba here a while back, and I've been using it and it seems to be helping the hair. Now, mentally they fatigue quite rapidly. And you got to watch these people for a high cholesterol buildup. Now, here's the catch. A hyperthyroidism person will usually be carrying high triglycerides, whereas a hypothyroid person will frequently be carrying high cholesterol. But it doesn't make any difference. Remember the ionization effect. If you have an abnormal ionization on the membranes lining the various vessels and cavities of the body, either one's going to produce damage. And there is much evidence that the triglycerides are more damaging overall than the cholesterols right now. The cholesterols can be brought out of there utilizing vitamin A, high vitamin C, vitamin E building up from small doses to succeedingly larger doses, selenium and manganese, these things will begin to pull cholesterol out of that system if it's established in the system. Sometimes it's difficult to handle those triglycerides. Lecithin, however, seems to be pretty good at whipping the triglycerides if they're in the proper pH. If they're too low, you want to watch using lecithin right off the bat because you'll dump it too fast. So, you've got that. Now, let's take a look at what you can feed into this person's diet that will now help you support the adrenals, the pituitary, and the thyroid if you want it supported. And here's where it gets easy. Just add dulse to their diet. It makes no difference to the thyroid. If it's slow, it'll speed up. If it's too active, it tends to sedate it. Dulse, D-U-L-S-E. Now, down the road from here is Dr. Jensen's farm or ranch or whatever. And so anyway, we know that a couple of people are going to be going down there tomorrow picking up a bunch of stuff. And if you, some of you think that you are either hyper or hypothyroid, you want to try a little bottle of this stuff. It's down there, and you want to watch something, okay? Now, they've had children. Lynn had a child that drank a bottle of it, didn't he? Okay? And other than the fact that he was walking around on the ceiling for a while, it didn't seem to bother him. But I will tell you something, and that is, if you load some people who are on the acid side especially with too much dulse right off the bat, invariably they'll start getting a sore throat or cold-like symptomatology. I don't know what's causing it, what the tie-in is physiologically. Okay? So if you are going to use dulse as a NEFI, a non-essential food ingredient, why, you be super, super careful that you start off slow with a few drops and then gradually build up. Now, if you're a chiropractor or a good reflexologist, or if you have studied this Touch for Health so that you understand basic muscle testing, and this is a pretty good book if you haven't gotten it, why, please do. It's an excellent book to have. But anyway, if in fact you are in this particular situation, you will find that it is very, very easy to determine what you want. Okay, now you have to be able to determine for the doctors, you have to determine whether or not they have an underactive or an overactive thyroid, and you can determine this on yourself, but some of you cannot do this on your clients, so do not do it. Doc even used to mention that you should have a good stethoscope and listen to the heart. But in recent months, he's even realized that some of the people were getting into a little bit of trouble with that. So sometimes you cannot touch or perform tests on the person. In fact, in some states, it's even illegal to perform the test that we're performing. But we get by with it, but we don't want to overstep our bounds. But here's what we do. If you want to know whether this person is a hypothyroid person, very simply, or a hyperthyroid person, again, very simply, all you have to do is take the pulse pressure, and let me write it out first and I'll explain it. All you have to do is take the pulse pressure times the pulse rate and cross off two places. Okay, then I'll give you the norms. Now, how many of you know what systolic systolic blood pressure is? Okay? How many of you ever seen someone say that they have blood pressure of 120 over 80? How many of you are familiar with that term? Okay, this 120 is the systolic pressure. It's actually first phase systolic pressure. There's two other phases, but that's the one we're interested in. And this is fifth phase diastolic pressure, or diastolic pressure. Doesn't make any difference. The thing that we're interested in is the difference between them is pulse pressure. So what's the difference between this? 40. Okay? So pulse pressure is the difference between your first phase systolic pressure and your fifth phase diastolic pressure, or if you take your blood pressure, it's the difference between the two of them. Okay? Now, times pulse rate. What is the pulse rate? The number of times that your heart beats per minute. Now, to get a good pulse rate, don't take your pulse for 15 seconds and multiply by 4. Because very frequently, when you start taking your own pulse, if you're not careful, your pulse will speed up. So measure it all through the entire minute. Take it for 60 seconds. Okay? And let's say that you're off 1. Would you in fact be off 4 if you took it for 15 seconds and multiplied by 4? If you were off 2, could you be off 8? Too much of an error. Take it for a minute. Let's say that it's 70. Now, what's the next rule? Cross off 2 places? In this particular case, we have a person that has a 28. Now, what does this mean? Okay, let me tell you. If the number is less than 21, if it is less than 21, suspicion a thyroid deficiency. If it is less than 21, suspicion a thyroid deficiency. If it is more than 38, if it's more than 38, suspicion a hyperactive thyroid. Now, how is it going to get up there? Well, if tachycardia is a characteristic symptomatology of hyperthyroidism, and if tachycardia starts at 100, if I was to take 100 times 40, would I have 40, and that'd be proof that I had an overactive thyroid? Just the pulse rate itself is what's going to make the difference, see? Now, what's ideal? Ideal is 26 to 28. Is this old boy pretty good? Okay. Ideal is 26 to 28. You get below 26, you're starting to slow a little bit. You get above 28, you start to speed up a little bit.
What about your athlete, 52?
Nevertheless, it works. Yep, it works. Okay. Now, that takes care of that. Okie dokie. Now, that gives you some idea now of what to take, and that takes us up in our grouping today. Let me see where we're at. Okay, that takes us up right now to we're at L, the porcelain eye, and Doc is now going to cover with you the no picture, and he's going to probably carry you through now till the 6 o'clock supper break. And so what I'll do is probably see you guys then first thing in the morning or after Doc gets finished with you in the morning. Okay? So here's Doc. Sort of like here's Johnny, isn't it? Here's Doc. Okay, here's your thing. You left it here, Doc. And I'll roll this up out of them. You've got plenty.
One of the questions I'm so often asked is, what do you mean by no picture? How many of you had that problem? No picture. Now, it may be on the first test or second test or third test, but generally it's on the first test. And a no picture simply means that the body is in a state of chemical change and there is no picture. Numbers paint pictures, and not only that, they're a language. They talk, they speak. If you don't believe that numbers talk and even scream, just look at your bank statement the first of the month. Also, you look at your thread, and on the end of each spool of thread there's 2 numbers. One denotes the color, and one denotes the size of the thread. The higher the number, as far as the size of the thread, the smaller the thread. The lower the number, the larger the thread. So if you had a 16 over 50, you'd have a navy blue, I beg your pardon, a 14 over 50, you'd have a navy blue, and 1/50 of an inch thick. So numbers talk. They paint pictures. So whenever you have a series of numbers and there's no picture, it means that there's conflict in the body chemistry. There's 2 reasons for it. There could be an error in testing, or there could be the equipment is not clean, or it could be that the body chemists have changed their diet in the last 24 hours, or 30 hours, or 3 days, or such a matter, and their body chemistry is not leveled off. So it's very important to pay attention to some numbers that I'm going to give you here to describe a no-picture problem, and I'm going to give you 3 or 4 of them, and there's many of them. But one of them, you'll find that the sugars is less than 1. You'll find the pH, it can be anywhere. So I would say anything from 520, this is another, to be 750 or even higher. This is pHs, and even 8. I'm making a problem with no picture now. This is pH range, yes, and I'm showing you on the first test.
Anything to 25?
I'm saying it can be anywhere in there on a pH. In other words, the pH is not really a determining factor of no picture. And I would say that the salt would be 6, from 0 to 6 would be a salt, and of course the 4M would have no bearing on it, and then the total of the urea would be probably, it could be 0 over 4, or anything less than the total of 12. There's no picture there at all, period. Even on a first test or a second test, there'd be no picture there. Now, suppose that we had the same problem I gave you this morning, and 3 days later you had this number. It would be perfectly all right to have this number, because you're not expecting a picture at that time. It denotes that the body chemistry is changing, which is highly favorable. Do you understand what I'm saying? In other words, the body chemistry is favoring. Now, how do you know whenever the body chemistry has completed the change? Whenever the the urea gets above 12, you know that you're through with the total is above 12. You know that you're over the worst part, or the first part at least, of a body chemistry change. And suppose, for instance, you tested a bedridden patient who had been bedridden for many months, and you come up with this kind of a number. It means that the body chemistry is changing unfavorably day by day by day, and you have a dying patient on your hands. And the first thing to do, if they have the 520 over 520 or even lower, would be to give high amounts of vitamin D, 10,000 units of vitamin D, and lime water. This is the first step, and also Cal-2. Begin to give it up, but I would, regardless of the weight, I'd only give 1 Cal-2 3 times a day. That is, if this condition had prolonged for a number of days. I do not advise at any time that anyone during the fast of 3 days of lemonade and water, those that can take it on the fast, take any vitamins or minerals during that time, or of no kind whatsoever, because there is a factor involved there on the color of the urine. The more transparent the urine, the less need of vitamin E. In other words, the darker the urine, the more it shows, the thicker the urine, and the more cells it's in the urine. Nature is responding, but they need vitamin E to keep the blood thinner. Vitamin E thins the blood. So these are factors in low blood sugar. Now let me change just one number on here and show you something that's going to make all the difference in the world. Leave everything correct except the urea. And that's over on the urea, put 7 over 10. Now there is a picture. Now there's a picture. The picture is low blood sugar, and if the pH is extremely low, you still have the same calcium deficiency. You have a very, very sick patient on your hand. And also, if you have if it's the second pH numbers in this range, you have a patient that his food is digesting too slowly, and that they are in serious need of colonics. And many times you'll find this reading when people have had chemotherapy. In other words, it shows a malfunctioning of the liver. And the finest thing to do, and it also shows that the person is lacking in vitamin C, their body is not assimilating vitamin C, and also it shows that they are a candidate for arthritis or lumbago or soreness of muscles, or they could also be a candidate if that salt, now that salt would have to rise up to in the 20s or above, there would be a candidate for old-fashioned scurvy, or what's the new name for it? Coligon disease. There'd be a candidate for that. In coligon disease, you have a dryness of mouth, in advanced cases, thickness of the skin, and even they look like they're inhuman, something that they picked up out of the funny paper. They look awful, very badly. And the darker skinned people are more subject to this disease than the lighter skinned people, that is, in its exaggerated form. However, you find plenty of Caucasians that do have scurvy in a minor degree. Also, it's weakening, very weakening in its advanced stages. And also, you will find that in the Colligan disease, that it's all over. I mean, the delta cells are from the top of your head to the bottom of your foot. They're in the breast, they're in all parts of the body. They're in the stomach, they're in the lungs, they're in the legs, they're in the feet, they're in the joints. And one of the first questions of the early stages of this Colligan disease, is which is very close to a no picture except for the urea, and that is, do you have soreness of muscles or joints? This is a question to ask. And if they say none, they're either in an early stage of it, or it's just a plain case of food digesting too slowly. In every case, they would have low blood sugar. And all cases like this should be in a retreat. All cases like this should be in a retreat. Now I want to give you some cases here that should be in a retreat. And the reason for I wish we did not even have to have retreats. They're an aggravation and a worry and a legal fight and a hassle all the time. And I just wish we could give everybody a diet they could take it home and just get well by themselves, but they can't. Because many times a body chemistry will change from day to day, and you have to change their diet, especially when their reserve energy rating is too low. They may be too alkaline one day in the urine sample and too acid the next, and vice versa, or other symptoms. Also, when people go through withdrawal, they have all kinds of symptoms: nausea, swelling, sick stomach, tingling, pins and needles, and they get terribly frightened. And they think that you're a quack, you don't know what you're talking about. So rather than to lose a patient and their client, send them to the retreat. Oh, I haven't got the money to go to a retreat. I'm busy. I'm working. Well, you can't give them any diet if they got these kind of numbers, or the kind I gave you this morning, and keep on working, and no diet will take. You've got to slow down and do nothing for a week or two for the body to accept the diet. One of the great causes of the body not accepting a diet is that people's body chemistry loses its rhythm. They don't have any definite time to eat. They don't have any definite time to go to bed. There is no pattern in their life. They don't have any special time for their toilet habits. And therefore, their body chemistry is in a continuous state of confusion. And in a retreat, you get it back in rhythm again. Now, anyone having a sugar with 550 or over should be in a retreat. Anyone having a pH on the bottom, this is the saliva, of 520 or less, regardless of where the top number is. It doesn't matter where the top number is, but if that bottom number is 520, the saliva, that's a case for a retreat, because it means that the liver is in very serious shape. Yes. Oh, I'm sorry. Thank you for helping me, my dear. I am hard to see through. Also, whenever you find a saline that's 45 or above, you should have them in a retreat. Any one of these factors is enough to suggest going to a retreat for. Pay no attention to the 4M or 1M or 2M or anything else as far as the retreat. That one does not have any direct bearing. Well, in rare cases, it will take up a little later, yes. But if the urea total is above 24, then that's your retreat. Because with a 45 salt and a 25 urea, they are in the zone for a fatal heart attack. In other words, the two together. So don't take the risk. Let the retreat go where they can test them 2 or 3 or 4 times a day. Another case is when a patient is on insulin, Oronate, or Debenese, or where a person has a visible sore that will not heal. That is a case for a retreat. Do not try to handle these cases yourself. Send them to a retreat where they can do more and more for them. A number of states now have passed laws for the use of Laetrile, but it's not to come into effect until October the 1st in most states. Nevada is an exception, but there's no retreats in Nevada at the present moment. We hope to have one before the year is over. So these are factors that you need to know in regard to body chemistry patterns. Now, let's take another body chemistry pattern that needs to be in a retreat. Now, one thing I'll tell you about people who need to be in a retreat is this, that if they need to be in a retreat, do not give them a diet. Well, I paid you $50 for a diet. No, they didn't pay you $50 or any other price for a diet sheet. They paid you for the test. And if they need to be in a retreat, send them to a retreat. I'm not trying to fill up the retreats. I'm trying to get them their body chemistry pattern from the wrong ranges into the range of zone 1 range, of which I'm going to take up in just a few minutes. They're moving them into the, probably Dr. Black covered it this morning, but I want to cover it again a little more thoroughly this afternoon. Do not give them a diet. Now, well, I haven't got the money. Well, if the doctor said to go to the hospital, they'd go. I've got a job. I'm a school teacher. I can't leave. Well, the point is, it doesn't matter what their profession, what their excuses is. If their numbers are in the danger zone, they better get into a retreat. Well, can I go in July or August? Well, if the saliva pH is 580 or above, then it would be rather, it wouldn't be quite so serious unless they had a urea that was over 25 and a saline that's over 45. They may not make it. You can also, in our next class, you're going to learn to describe people by their numbers. You're going to look at, and I'm going to put numbers on this screen here, and then you're going to try to describe what the person looks like by the numbers. In other words, learn to visualize what the patient looks like by looking at the numbers. How many of you have been doing that, or been connecting it up? Some of you have been doing it. So this is what you need to know. Then you can see people with outward appearances, and you'll know in what range some of their numbers are, vice versa. But when somebody calls you on the telephone to read the number, and you don't even see the patient, then you see it through the numbers. The computer won't be able to look at the patient, but it'll still tell you what the problems are by the numbers. So the thing about it is the inward body chemistry has outward body effects and emotional effects. Anyone with low blood sugar, as you would find in the first problem I've just given you here, up here, generally, except by the grace of God, of which our instruments do not measure, you would find an irritable. They're fighting for their life, especially if they had a low calcium. And they would be grouchy if they had the high calcium, and especially children. Now, suppose that this was a child's reading, and he had the 1 and the 750/8, you would have a hypertensive child on your hand. All hypertension in children is due to constipation, due to food digesting too slowly, food that is too heavy for the child. So I have given you before, and you have been given before, children under 8 years old should not have any nuts or nut butters and no meats until after 12 years old. And you're asking for problems in hypertension and doctor bills if you do it. Now, let's look at this next problem we're going to look at here, and this is one in which we're dealing in range 1. This is the goal that we're working toward. Which way? Other way, okay. This machine is almost too complicated for my simple mind. Okay, now, every one of you by now, I'm sure, knows what your perfect numbers are. That is your perfect numbers, regardless of where their body chemistry numbers are. This is what you are trying to do, is to give them a diet to get their numbers to come toward perfect. Now, you were told this in the first course, and I'm reviewing it. Now, suppose the first problem we had this morning that we had, and you were running a retreat, and that's your retreat, or any patient that should be in a retreat. This is what the goal that you would work for, but as they go through withdrawal, they go through all kinds of symptoms. It's absolutely unpredictable. I've seen them go into convulsions. I've seen them become comatose. I have seen them vomiting, sick stomach, tingling. They feel like the flesh was crawling off of the bones, and they need encouragement at this time. So getting them into a retreat where in the first day or a few hours somebody's going to tell them what they went through, and the counselor has told them what to expect, and therefore it's not bad. But they tried at home, and they're just sure that you've killed them. They're just sure that they're a goner, because they've got no one to encourage, or no one to sympathize, or no one to talk to, or no one to say, well, I had the same thing, and I went through it, and so forth. Now, whenever the first vomiting takes place, generally, if the person is quite ill, it's very, very green in color, and very, 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 very bitter tasting, and it only lasts for a few minutes at a time. But about 1 minute before you're up, Chuck, it feels like that it's just impossible to live another 5 minutes. You just know you're dying. And then it comes up, generally quite easily, and 5 minutes later, you're feeling like $1 million, and you don't remain ill and hanging on and lingering on and lingering on, unless this vomiting is brought about because of an insulin reaction. And if it is, and the vomiting continues, the patient has to be put into a hospital wherein they can control the vomiting. Now, we could do it out here or in a retreat, but we're not allowed to. It's only a matter of giving a suppository to stop the vomiting, but they won't let us do it. And it's against the law to get people well. And any profession that needs needs laws to keep it for it to survive is a bad law. It's a bad profession. If you've got something good, you shouldn't need legal protection to practice it. But it's also a safety law, because there are people that are unscrupulous that will abuse the privileges. Now, in this...
Can you say people who are on insulin have a reaction?
May, 1 out of about 300.
And what kind of information?
The thing about it is, this has to be done in a hospital. There's about a half a dozen different kinds they can give. But the thing that I'm saying is, those patients must be put into a retreat. Do not try to take anyone off of insulin, either if you run a retreat or if you don't run a retreat. Or if you are running tests, do not take anyone off of insulin. Let them do the clinical test and set their own rate. But don't move them down too fast. Let them do that. There is a ratio that you've already been given between the urinary sugar and your glucose sugar. Your urinary carbohydrate is your total of all sugars. The glucose is only one kind of sugar. So the glucose in the blood carries oxygen to the brain, and if it's too low, it doesn't carry enough. If it's too high, it doesn't carry enough. The symptoms on both sides are exactly alike. Now, in this perfect problem here, this is the goal you work toward, but suppose that it doesn't matter what range or zone the numbers were in, and this is what you want. But suppose that on the third day that you had something like this, you had something coming up like this.